So any skin conditions such as eczema, dermatitis, psoriasis, we absolutely want to avoid those areas. All that's going to do is cause worsening of the condition and cause further irritation. Any types of scars. So in regards to scarring, sometimes clients have a true history of what's called keloid scarring and hypertrophic scarring. You will learn about these in class. Now, if client has a true history of these types of scars, we do want to avoid the procedure in general. What this is going to do is cause a keloid or a hypertrophic scar after the piercing. Now, we want to do everything possible to avoid this. Sometimes keloids can form or hypertrophics can form after piercing, but if client does have a true history of it, we do want to stay clear of that. Now, technically, it is a condition where the body heals a wound or an injury or any trauma to the skin in an abnormal way. You will learn about that in class, as mentioned. Now, any types of nervous system dysfunctions, okay? We need to ensure that client has doctor approval. We may not be well adversed in many of these, conditions, but technically we are piercing through the skin where there are many nerves to be found. So if client has a severe nervous system disorder, that could be a cause of concern for maybe different types of paralysis. In regards to client who is on blood thinners, or client who has a blood clotting disorder, we call that hemophiliacs. We want to avoid, because there is going to be an excess amount of bleeding that is going to happen, and that could actually interfere with healing as well. Okay, so if client is on blood thinners, we definitely cannot advise client to go off of their blood thinners, okay? That is up to a medical a medical physician to indicate that. But when somebody's on blood thinners, it is, absolutely crucial that they are on those blood thinners for a reason, okay? Now, we're going to be talking about pre-care instructions. Some of those pre-care instructions are to avoid certain things that may possibly thin the blood. But in regards to true blood thinners, we cannot advise client to stop taking their blood thinners to have a piercing done. In regards to certain, medical conditions such as heart disease, okay? Anytime we're dealing with the heart, that could be heart disease, a previous heart attack, maybe client has a heart stent or a valve, okay? Anytime we're dealing with the heart, we do have to take very high precaution measures, okay? Because anytime we break skin, we are exposing the area to bacteria, okay? So technically, those who have heart conditions, anything heart related, they do need to technically see their doctor, and their doctor has to approve of the treatment. Now, if doctor approves, doctor more than likely will have clients start an antibiotic, which is usually called an antibiotic prophylaxis. And what this does is it does reduce the bacterial level to ensure that bacteria does not enter the bloodstream and to the heart. Now, other types of conditions such as blood pressure, okay, so that could be high or low blood pressure. We do want to have a doctor's note. Any types of autoimmune diseases, okay? Now, technically an autoimmune disease is when the body mistakenly attacks its own healthy tissue or its own healthy cells. So there are about 80 autoimmune diseases that are known, and some of them are more serious and some of them are less serious, okay? So technically with any autoimmune disease, what is happening is the body is not technically functioning to par, okay? So whatever the type of disease they have, that disease is compromising certain cells in the body, certain tissues within the body, certain organs. And technically, when we do anything that is considered to be more invasive, that is putting harm to the body as a whole, okay? So the healing rate for those who have autoimmune diseases is a lot slower, okay? The infection rate is a lot higher. So there is that risk of possible infection with those with autoimmune. And with that, in turn, sometimes that can lead to more serious complications within the body as a system, okay? So any type of autoimmune disease, it is important to ask client to retrieve a doctor's note, okay? Because there are more serious autoimmune diseases out there where we should not be putting client at risk and we should not be compromising their health for a piercing. But there are more, lesser serious, not serious autoimmune diseases out there as well, okay? That could be, a situation where doctor may approve, and we would have to ensure that client absolutely follows aftercare instructions, okay? So, for example, diabetes, okay? Diabetes type 1 is considered to be an autoimmune disease. A lot of people don't realize that. Diabetes is, unfortunately, growing to be more common. And it is something, that we do need to take seriously. So there are many, many types of autoimmune diseases. Now, we have to ensure that we are not treating anybody with an autoimmune disease without a doctor's approval. Now, anybody who technically has any allergies to any metals, okay, so we are going to be going through a list of the approved materials and the non-approved materials for the jewelry for piercing. So we have to ensure that if client does have an allergy to a certain metal, that we choose an alternative type of material for the jewelry. Or if we can't, then we may not be able to do the